Okay, starting from the beginning. Deltoid, subscapularis. Coracobrachialis. Biceps brachii, short head. Biceps brachii, long head. Deep to the biceps brachii is the brachialis muscle. Brachialis muscle. Brachialis muscle. Okay. Supraspinatus. Infraspinatus. Teres minor. Teres major. Teres minor. Teres major. Triceps brachii, long head. Triceps brachii, lateral head. Triceps brachii, medial head. Down to the forearm. On the anterior compartment, we have, well, the lateral muscle. This is the brachioradialis. Brachioradialis. So we have pronator teres. Flexor carpi radialis. Palmaris longus. Flexor carpi ulnaris. Deep to these, we have our flexor digitorum superficialis. Flexor digitorum superficialis. Move this. Okay, so that's the flexor digitorum superficialis. Deep to that, we have our flexor digitorum profundus. Flexor digitorum profundus. And lateral to that is our flexor pollicus longus. Flexor pollicus longus. Okay, so using our brachioradialis as a landmark to help us identify and differentiate between the different extensor muscles. So starting with the brachioradialis, we have our extensor carpi radialis longus. Extensor carpi radialis longus, extensor carpi radialis brevis. So longus and brevis. Okay. These are the ones innervating, or these are the ones that go to the thumb. So we'll come back to those. This is the extensor digitorum. Extensor digitorum. Then we have a muscle that is going specifically only to the pinky. That is our extensor digiti minimi. Extensor digiti minimi. Finally, okay, this one, that's our extensor carpi ulnaris. Extensor carpi ulnaris. There's a tendon going only to the index finger. That's actually a deeper muscle. That's your extensor indicus. Extensor indicus. Okay. Look this up. So looking from this view, we see there are 3 muscles, 1, 2, 3. So 3 tendons, 1, 2, 3. The one that is the most lateral, okay, that's the abductor pollicus longus. Abductor pollicus longus. Yeah. I think this model doesn't show a very good job of how this attaches to the side of the thumb, because it's supposed to go to the side of the thumb. Okay. This is the extensor pollicus brevis, extensor pollicus brevis, and then finally extensor pollicus longus. Okay. The common flexors originate from the medial epicondyle of humerus. Lateral and common extensors originate from the lateral epicondyle. Okay, from the lateral epicondyle of humerus. In terms of arteries, we have axillary artery continuing on as brachial artery, which then branch to form radial artery and ulnar artery. Radial artery, ulnar artery. Okay. Ulnar artery travels along with the ulnar nerve. So up here, you can see the brachial plexus. We have the musculocutaneous nerve, median nerve, This is the median nerve going to the carpal tunnel. Ulnar nerve is right here, continuing next to the medial epicondyle of or just behind the medial epicondyle of your humerus, going to innervate your last 2 digits. Ulnar nerve. Okay. And then in cadaver lab, by peeking between the lateral head and the long head of triceps brachii, you'll see the radial nerve. Okay, so this is the left upper extremity, showing the blood vessels. With the arteries, the subclavian artery, continuing as axillary artery and brachial artery, which then branch to form the radial artery, it's more lateral, and the ulnar artery, that's more medial. For the veins, we have subclavian vein continuing the deep one next to the brachial, and axillary and brachial artery is the axillary and brachial veins. The superficial ones includes the cephalic vein, continuing down into the forearm, and the basilic vein, continuing down into the forearm as well. This is the median cubital vein, I think that's about it.